Hey, it's Jael from Cell-Based Nutrition, and today we're talking about the pressure of being a good patient. So for those of us who live with chronic illness, who live with complex health needs, who live with chronic pain, we spend a lot of time either attempting to make appointments or attending medical appointments. And there's this very complex dance that we play with being agreeable and advocating for ourselves. And so I wanted this video to discuss the nuances that arise from the dance between patient and doctor. Now, I want to start by saying that here in the UK, we are incredibly fortunate. We have free, universal, basic healthcare that is free at the point of use, which means that we do not need to pay upfront to see a doctor, to have hospital appointments, for testing, for none of that. Our healthcare system is paid for via our taxes, and for the vast majority of UK citizens, we don't pay anything towards our healthcare. We have a small prescription charge, and even within that, there are people who, if they want certain benefits or if they have certain medical conditions, can have free prescriptions. We are very proud of our NHS in the UK. There are many developed countries in the world who do not have universal healthcare. And so this video is absolutely not to take slight at our wonderful medical professionals, but it is to talk about the experiences that people who have complex health needs still have within a system that is free for us. The vast majority of medical practitioners are highly educated, competent professionals who do care about their patients and also care about their speciality. But with that comes a little bit of pushback when patients ask for more clarity, when patients are not sure about what treatment methods they want to go down, when patients maybe express symptoms or concerns that they have that may not necessarily look like they align with the picture that a doctor has got in their mind about what is wrong with that particular patient. And then on the other hand, you have patients who fear that asking questions, who fear that advocating for themselves is going to get them dismissed. And I'm sure there are plenty of people who have even had this experience where it's not a fear, it's something that became a reality, where a doctor has completely dismissed symptoms that they are describing, or has not given them enough of an opportunity to describe the fullness of what their experience is. And so we learn very early in the process of dealing with medical professionals that being agreeable gets you taken seriously, and asking too many questions changes the way that you are treated. And this causes delays in care and treatment plans. And especially when we start looking at nuances such as gender, where you have people with uteruses, fallopian tubes, ovaries, who have spent years, if not decades, not being taken seriously. It is so common to hear people say that it has taken 10 years, 15 years, 20 years to get proper diagnoses of things like endometriosis, adenomyosis, PCOS, fibroids, because symptoms, the subtle symptoms, are not pieced together well enough, and a big enough picture is not painted. And that leads to people suffering and people dealing with chronic pain conditions for a lot longer than is necessary. People living with no diagnoses, people living with no full understanding of what is happening to their body. They just know that they're experiencing these symptoms. These symptoms are uncomfortable and distressing and a lot of times painful, and there just doesn't seem to be a way forward. And that can't be something that we accept as normal. GP appointments in the UK are something that has become very difficult in recent years. So GPs are our primary care physicians here in the UK. They're general practitioners. You go to them at the first stage of any concerns that you have, and they're the ones who can make referrals to hospital consultants. GP appointments at the moment, from what I'm hearing, from what I have experienced myself and what I'm hearing from other people living with complex needs, is that they're very short. You would be fortunate to get a GP appointment that lasts more than 10 minutes. A lot of patients are being told that they can only discuss one issue with their GP. Now, this raises huge problems for people who, like me, have more than one chronic illness. So if I am having symptoms and I can't quite identify exactly what is causing it, what do I go to my GP to say for the one topic that I'm allowed to discuss? Things don't always fit into a neat box. A symptom that can look like, for example, for me, sickle cell pain, could also be osteoarthritic in nature, could also be neuropathic. The neuropathy could also link to headaches and migraines that I have suffered from and continue to suffer from. And then when you get generic internal pain, you know, is that organ pain? Is it gynecological pain? It becomes very difficult when you're living with complex conditions to be able to compartmentalize what belongs to what, and having a system that doesn't allow for the fullness of a person's health to be discussed can cause delays in people receiving referrals and then diagnoses and treatment. Although it seems like you're being put through the ringer, I would strongly advise that if you are living in a primary care trust area where you could only have a 5-minute appointment and you can only discuss one thing, and you have 4 or 5 things to discuss, that you make 4 or 5 different appointments. And of course, this can be difficult if you need time off work. This can also be difficult if you have mobility issues to be able to get out of the house and back and forwards to the GP surgeon. But I just don't want people to allow these barriers to prevent them from getting the treatment that they need and that they deserve. Because the only thing that delaying medical treatment does is it compounds your issues and it makes them worse. And by the time, you know, they finally get to the bottom of them, you've suffered for an extraordinarily long period of time. But I know, you know, that it's not easy, and it's a complex system. But we shouldn't adapt just because the system is struggling to hold complexity. Once you have been seen by GP and have managed to convince them that there is an issue with you that needs further investigating, then you're referred to a hospital consultant. And it's really at this point that you have to be able to advocate for yourself. You have to be able to describe your symptoms with clarity, in detail, and also it would be advisable for you to have educated yourself a little bit and done some reading around what thoughts you have. Now, this isn't, of course, to diagnose yourself. Absolutely nobody should be sitting on the internet and then diagnosing themselves. But I also think it is wise to be able to at least have some questions that you can ask your consultant about your conditions, especially if there are things that you are concerned at that haven't come up in discussions. There have been quite a few times where I have seen hospital consultants and I've been asked if I was a med student, which I find quite funny and I wear with a badge of honour. It's a story that I've told my friends very many times. And I think that's because I have been able to understand some of the disease processes of the conditions that I have. And I ask very nuanced questions when I'm trying to figure out what is the best form of treatment for me. I'm always the type of person who will ask the doctor to spell out the name of the treatment or the medication that they want me to take, and I do go away and do my own research. I think it's incredibly important to know it's informed consent. You know, I don't believe that a patient who does not fully understand what their condition is, what the treatment options are, can fully consent to treatment. You can't consent to something that you don't know. And going back to being a good patient and being agreeable, sometimes we nod along and pretend that we know what the doctors are saying, and we don't know what they're saying. We don't know what those words are. We don't know what those words mean. And because we don't want to feel embarrassed or ashamed that we don't know, we don't ask. Sometimes the doctors are actually oblivious that they are talking in science jargon, right? They're sometimes oblivious that they are not talking to fellow medical professionals. And there've been several times where a doctor's been like, oh, okay, let me tell you in layman's terms exactly what this means. And that means you can go away with knowing fully what has been discussed. And also your doctor has the confidence to know that their patient, if they have agreed to something, has agreed to something because they know exactly what they're agreeing to. Because often what would happen if you nod along and don't ask any questions is non-compliance. You know, and for doctors, that's a waste of your time as well. If you're prescribing medication, the medication's not being taken. If the patient doesn't understand what the medication is, what is the purpose of it, they're not going to take it. If they, you know, are delaying treatment or cancelling procedures or so on, it could just be because they felt rushed or they just don't have a full understanding of what it is. So it actually, the extra time taken to have full, clear conversations is actually worth the cost, as it were, upfront, rather than later down the line seeing the fallout from people not having clarity over decisions that have been made for them. Another way that we face the pressure of being good patients is if you've ever had the misfortune, maybe, of being an inpatient, and an inpatient for long periods of time. I've spoken before about long periods of hospitalizations where I've been hospitalized for 6 weeks at a time, 4 weeks, 2 weeks. And being an inpatient in hospital is not fun. And depending on your condition, you may have particular needs that are not being met. And again, the fear of either being dismissed or ignored or being seen as difficult comes up. So, for example, I have sickle cell. I have, like virtually everybody who has sickle cell, an aversion to cold. Cold causes constriction of the blood vessels, which then makes it harder for the sickled, misshapen red blood cells to pass through, which causes pain and also damage to blood vessels, veins, arteries, capillaries, etc. And that can cause an increase in severe pain, which is called a sickle cell crisis. If you have been an inpatient on a hospital ward and you have had the pleasure of those wonderfully thin blankets that you're given, you can understand why, as a patient with not just an aversion to cold, but a medical condition that is exacerbated by cold, would want to ask for additional blankets. And I have had periods in my life where I have sat and shivered because I didn't want, and this was obviously when I'm younger, I would never allow that to happen now. I sat and shivered because you just felt like you were asking for too much. Everybody else in the other bays that you can see has one blanket, and so you don't ask for one until a nurse with a hawk's eye sees you shivering, comes to ask you, are you cold? You nod yes. They come and bring you like 2 or 3 blankets and tell you that you should have asked for one. I mean, nurses like that are an absolute godsend. They really are ones who care about their patients and come round and are observant. They're fantastic. But sometimes that isn't the experience on a ward. Another issue is food. Now, I used to, when I was hospitalized, and I haven't been, thankfully, hospitalized for a sickle cell crisis in 7 years. But in my late teens and 20s, I was in and out of hospital like a yo-yo. And one of the things I used to do was photograph and post on social media the food that I was expected to eat. I don't eat meat. I haven't eaten meat. I stopped eating meat when I was a teenager. And so, maybe in the 90s and early 2000s, it might have been more difficult to accommodate a balanced vegan or plant-based, vegetarian even diet. But I struggle to understand why, and as you'll be able to see in the thumbnail, I went into the archives to dig out one of the wonderful hospital dinners or lunches that I was given, and that's not even one of the worst ones. And food is another place where inpatients feel that they can't really say anything because the hospitals have what they have in their kitchens, and you feel like you can't ask for additional things or alternatives But in the vast majority of hospitals, they do have alternative menus, and the hospital kitchen teams can accommodate the vast majority of dietary requirements, but it just takes a little bit of courage on our part to ask. And sometimes we don't know that they have, so then we don't know if we can ask. So then we're in a cycle of being given food that we can't eat, won't eat, and nobody's any wiser. We're not eating enough to fuel our bodies to recover. We're losing weight in hospital. Often that delays our discharge from hospital because, you know, they want to see that you are getting better, not worse. And so it's a very complicated dance. It is. And what I want to get across is that in all circumstances, staying quiet comes at a cost, and it comes at a cost to you and your health and your well-being. Eventually, when we continue to downplay our needs, we start to mistrust ourselves. We stop listening to the signals that our body is sending us. We delay asking for help. We don't ask questions when we have questions to ask. And then we begin to internalize that we are a problem, that we are a burden. And of course, that then impacts on your identity and your self-worth, which has already been knocked because living with a chronic illness or developing a chronic illness changes your identity in terms of who you used to be, what you were able to do, what your functionality or mobility was. And for many of us, being a good patient becomes part of our identity. We love it when a consultant says to another consultant, or a nurse says to the doctor, oh, she's been wonderful today, she's been good. When often good just means you were quiet and you didn't ask for anything. And who is that helping? We also need to understand that medical professionals, it's their job to look after us. And it's their job to look after us well. And feeling that we shouldn't ask somebody to do their job well because we are scared of what that could mean for us is such a toxic element that is pervasive in our healthcare system. So if you need permission, if you need permission to advocate for yourself, if you need permission to ask questions, if you need permission to not be such a quiet, polite, agreeable patient, then I'm giving it to you. You deserve care that doesn't require you being silenced. You deserve care that makes sense to you. You deserve care that you are confident in receiving, that you understand. And you deserve compassion at every point in the process. And especially for those of us who are living with lifelong, complex medical needs, we are always going to have to deal with medical professionals. And so the sooner we learn to make that process better for ourselves, more beneficial for ourselves, healthier for ourselves, the better. You know, this isn't a case of an acute issue, a broken bone, that requires resetting, plastering, and you know, within 6 to 8 weeks it's a done deal, and you never have to return to the hospital. For people who live with chronic health conditions and disability, medical professionals are going to be part of our lives for the rest of our lives. And what I would really love is that we can have more positive experiences wherever possible than negative ones. So I'm Jael from Cell-Based Nutrition. It has been lovely talking to you. Please like, comment and subscribe and help me grow the channel so I can reach more people like us who need to be part of conversations like this. I will be very soon sharing information with you about my group coaching program, which is the pain and fatigue liberation method, which is a naturopathic, nutritional, complementary therapy, alternative medicine approach to managing pain and fatigue. I am really looking forward to being able to work with those of you who want to work with me. I am working behind the scenes to get everything up and running, so I will soon have a link to share, so keep checking back on my videos when the course is ready to open its doors. I will let everybody know, and I just want you to remember that your body is not broken, your cells are just undernourished, and I will see you in the next video.